The immediate areas that we take care of are like Angola. We
Mhm.
get a lot of patients coming down from Angola, that's north of us. Fort Wayne area, we're like 15 minutes out from Fort Wayne. Actually, we're closer to parts of Fort Wayne than people who live in Fort Wayne are, because we're right off the interstate in Auburn. We get people coming over from LaGrange, Shipshewana, just a variety of, probably an hour circle around us is not uncommon. We
Mhm.
treat a lot of chronic conditions that most people don't. So we get people, sometimes they'll come a couple hours from different directions.
Wow.
My
Okay.
son works with me, a couple days a month. He has an office in Indianapolis. And, he treats things like thyroid and some really, a lot of metabolic conditions. He works a lot with those. So, and he actually teaches for a group called Apex Energetics. So he treats a lot of real chronic conditions. So we get some people coming quite a distance to see him at times. And then I'll sometimes help him treat parts of that condition other than what he's doing there metabolically. So
That's
yeah.
amazing. How did your son get the bug? Was it just from you, or, or
He
did you pick up his hands and say, these hands were meant for
No,
help?
I didn't. I always, when my kids were little, I said, do what you want to do, be what you want to be. And I never pushed him to be anything. And he just decided he wanted to go into chiropractic. And we've had a blast. He used to be full time with me. And then he decided, a lot of his friends were down in Indianapolis, which is like 2 hours south. It's a big major city.
Right.
We're kind of a small rural area. So I don't blame him. So he moved down there, but he still comes up here every week and works with me and spends a day in the office and takes care of patients. And he does a lot of extra stuff, talking about neuropathy patients. A big component of neuropathy is what we call the metabolic side. What's driving it from a physical standpoint? Do you have diabetic issues? Do you have inflammatory issues? Do you have gut issues that could be a component there? Are your D levels right? Are your B levels? So we do an extremely comprehensive blood profile when we take a case of neuropathy. He does all the analysis, sits down and spends 45 minutes to an hour describing, oh yeah, it's intense, describing, and he goes through every blood test and explains exactly what was done there. So we go over and above what you normally get done. We test things that are not normally done. We look at CRPs and we look at homocysteines and all kinds of different markers that are involved with neuropathy that nobody else ever looks at.